Hello and welcome to this episode of the Hospital Guide. In today's episode, we will be speaking about how to recognize a fake doctor. Now you can see these beautiful flowers. Somebody gifted them to me. But do you know that they are fake flowers? You really can't make out, isn't it? But they're made from fabric. Now, similarly, you could be having a fake doctor who could be practicing in your locality. And how are you going to protect yourself from getting treated by such a doctor is what we are going to find out. Now, in order to know what is a fake doctor, you need to know what a real doctor is like. A real doctor is a registered medical practitioner, which means such a person has fulfilled three criteria. First, he has undergone training from a recognized institution in India or any other place which is authorized. He has got a degree and he is registered with the state medical council where he is practicing. So until all these three things are not met, the doctor is not an RMP. The doctor who has done the basic training attains an MBBS degree. Subsequently, the doctor may pursue a specialization, like for example in general surgery, orthopedics, gynae, etc., and be conferred a MD or an MS degree. Later on, this doctor may decide to pursue a super specialization, which is again a 3-year training program, and be conferred with an MCH or a DM or a DNB in that super specialization. For example, that could be cardiac surgery, neurology, neurosurgery, so on and so forth. Now, there are certain fellowships also which are there in academics. These fellowships could be 1 or 2-year training programs in India and abroad. And these are essentially to upgrade the skills. The doctor may undertake these fellowship programs. Also, there are a number of observerships and internship programs also, and these may range from about 2 months to 6 months. Mind you, an observership or an internship normally does not give rise to any hands-on experience, and these are just a person trying to get acquainted with a particular specialty without any hands-on training. In certain states, there is an FCPS or a CPS degree, and these states do recognize these degrees and diplomas which are conferred by the College of Physicians and Surgeons. Having said that, the status of these registrations keep changing, so it is worthwhile to check with whether the validity is current or not. So then who not is a registered medical practitioner, or rather who is a fake doctor? So as we said, if those three criteria are not met, then a doctor is a fake doctor. So, 1, he has not completed his training from a recognized college. 2, the doctor is not registered by the state medical council, or for some reason the registration of the doctor has been cancelled, or somebody who is not a doctor in itself but he is actually practicing like a quack. So such people could be fake doctors, and they could be masquerading with a stethoscope and having a clinic in your locality and treating patients. Now, there are certain degrees which are conferred by certain countries, like you may be reading about doctors undergoing training in Russia, China, Ukraine, and so on and so forth. These degrees are not recognized by the Medical Council of India, and such doctors have to undergo something called as an FMGE examination, which is a Foreign Medical Graduates Examination. A doctor has to pass this exam, and then this doctor gets a provisional registration certificate, which is then after a period of time converted into a full registration. And only after clearing an FMGE exam, a doctor who has passed from certain countries whose degrees are not recognized can qualify to practice in this country. India also has a provision for reciprocal recognition of degrees from certain countries. So there may be a tie-up with the respective countries, and the degrees from those countries will be recognized in India because those countries are recognizing the degrees from India. So please note that when a doctor writes an MD, that MD needs to be specified as to what MD it is. An MD, for example, could be MD anatomy, it could be MD physiology. Any MD is not an MD. So if a doctor is an MD physician, then he is normally an MD in general medicine. If a doctor is MS, then he is an MS in general surgery. And MS in general surgery is not the same as MS in orthopedics. So it needs to be very, very specific as to what specialty the doctor has done a specialization in. Also, one must note that the level of experience. Now, a doctor may say that he has done an observership or an internship training program, or he has done a 6-month fellowship program. Now, there are certain degrees in India which give a degree. So, there is a 3-year neurointerventional degree program which is awarded by certain medical institutes. And the level of competence that a doctor who has undergone this 3-year training will not be the same as somebody who's done a 2-month observership. So you have to be very, very mindful when you visit these doctors, because these are extremely niche specialties. Okay, so how do you find out whether the doctor is fake? Of course, it is very, very embarrassing for any patient to ask the doctor that, doctor, are you really genuine? And do you have a degree? Because the doctor might really get insulted. The other thing is, when you're loitering or you're wandering in a doctor's clinic, there could be a degree certificate which is hung on the wall. Most doctors, if they are in their private clinic, will hang these or display these certificates on their walls, which mention the name, the registration date, and the specialty in which the doctor is registered, and the state medical council number. Also, when they are signing any prescription, they will usually sign and they will write their registration number below the signature, which ensures that the doctor is a registered medical practitioner. A fake doctor is usually not going to do that, but having said that, you could have fake degrees which are being displayed and fake registration numbers which are being generated, and it will be very difficult for you to find out whether the doctor is real or fake. The second thing is that every state has got a state medical council. This state medical council has an updated register of the doctors who are registered in the state medical under the state medical council. So you could go on the website, and by typing the registration number or the name of the doctor, you will be able to find out whether this doctor is registered with the respective state medical council or not. Now, all these things are too much of a hassle for a common person, and why should somebody waste their time and energy in doing all these activity? So there's a simpler and an easier method by which you can find out whether the doctor is real or the doctor is fake. An NABH certified hospital ensures that the doctors that are practicing in the hospital have the required degrees and are registered with the respective medical council. Because it is mandated by the NABH and the Quality Council of India that the credentialing and privileging of the doctor needs to be done. Therefore, whatever is your headache is actually taken over by the headache and is converted to that responsibility of the hospital. And you can be rest assured that when you are visiting an NABH certified hospital, the doctor who's practicing in that hospital has a genuine degree, is registered with the state medical council, and you can be rest assured that you are in safe hands. And therefore, it's always better to go to a NABH certified hospital. It might be slightly expensive for you, but in the long run, you can be assured that you're treated by the right doctor. So today you've learned how to recognize a real doctor from a fake doctor. Next time when you visit a doctor, you can be rest assured that you are aware and you are being treated by a qualified individual. If you like the video, please like and subscribe and share for maximum awareness. Thank you so much for watching.